You probably have one at home, perhaps you have one at work. A first aid kit with everything you need from a cut or a scrape to accidental poisoning. But today we want to talk about a different first aid kit, a mental health first aid, something that is extremely necessary, especially for young people. And to help us do that, we have Michael Trader. He is the Director of Planning, Quality, and Core Services at Worcester County Health Department, along with Jacqueline Sturgis. She is the coordinator of the Mental Health First Aid. Thank you both for joining us this afternoon. So I want to just jump right into this mental health first aid. What exactly is it?
So, you know, we talk about health, right? And we talk about our physical health, our somatic health. And one of the things we want to get people talking about is your mental health is just as important. It works the same way. And just like your physical health can start to break down and you might need first aid for your physical health, same thing with your mental health. So mental health first aid is a training, it's an evidence-based training that we offer. It's a way to try to teach people how to recognize when those around us are struggling and know how to assist, how you can get involved and how you can help and be part of the solution.
Yeah, and this is especially important for young people, isn't
Absolutely.
it? Why is that?
Here's the biggest thing is there's such a stigma that surrounds mental health, and especially with our youth. You know, we talk about labels, right? We don't want to label people with specific mental health disorders. But the biggest thing is we want to be able to have a conversation with someone, right? And that's what mental health first aid does for our youth. Sometimes we get nervous, we get scared, we may not want to be involved. You know, if we get involved, then we have to do something. But mental health first aid is really important because our youth, it shows that if they have one trusting adult, their likelihood to attempt suicide goes down.
A physical first aid kit is something, if the injury is severe, it's something that can help until you get medical care from a professional. But that usually happens in a couple minutes. With mental health, there's some kind of statistic that it could take up to 10 years?
Up to 10 years, absolutely. So one of the statistics we look at is it takes on average up to 10 years after the start of symptoms before people actually reach out and get help. And you know, we do that for a lot of different reasons. You know, sometimes it's stigma, it's not knowing where to turn, especially when you're talking about young people. Oftentimes they don't understand what it is that they're dealing with, you know, and it can be very confusing and tough.
Sure. Now, Jacqueline, you had mentioned talking about suicide and the suicide rates and teens thinking about it.
Yeah.
Some people don't even like to use that word.
Yes.
Around
So
them.
the biggest thing, you know, we here on the shore, we usually encompass our tri-county, right? We call them our sister counties. So Worcester, Wacomico, and Somerset, we run a survey. It's called the YRBS. It's the Youth Risk Behavior Survey. And that data actually comes from the youth themselves. And this, for the tri-county, it actually came back as 19% has actually attempted suicide among high school students. So 19%, you know, that's 1 in 5, which, you know, to us, we say that makes sense because one of the other statistics is 1 in 5 youth suffer from a mental illness. So, you know, those numbers are alarming. You know, you think 1 in 5, it's really high. And, you know, the biggest thing is, will you ever be comfortable with talking about suicide? Nobody in any profession, even a mental health professional, is not comfortable talking about suicide. But what we want to do is develop your confidence level so that you feel confident saying, are you thinking about suicide or are you thinking about killing yourself? You know, those two questions are what we want you to ask. We don't want you to ask about, are you thinking about hurting yourself? Unfortunately, because no, the hurt will end. So the word suicide is very alarming. You know, it's still, we've been in the profession a long time. You know, it still sends chills up our spine if we have to use that word to ask somebody if they're thinking about it. But that is a blanket, you know, word. It doesn't mean anything other than what it says. So,
well, you know, one of the biggest stigmas out there is if we talk about suicide, it's going to encourage people to do it. And we hear that all the time. But the statistics show otherwise. You know, what the data shows and what research shows us is that more often than not, what it does is it actually opens the door for people to talk about sort of that hidden thing, that secret that they didn't feel comfortable talking about before. But once you open that door and you use that word, now suddenly it's okay to talk about. And that's one of the things we want to make it okay for people to speak what they're feeling and to say it out loud.
Well, Michael and Jacqueline, thank you so much for coming in. And of course, we're going to have a link on our website so
Absolutely.
folks can find out where and when they can get this mental health first aid training.
Absolutely.
Thank you.
Thank you
Thank
so
you.
much.